Hello students, welcome to Physio World. This is our first lecture of sports injury and today we are going to discuss slap lesion. First we will see what is slap lesion. Slap lesion is an injury to the glenoid labrum. Here you can see the glenoid cavity. Glenoid labrum is attached around the margin of the glenoid cavity. And if there is any kind of injury to the glenoid labrum, then we will call it slap lesion. If we look at the mechanism of injury in athletes, direct blow, fall on outstretched hand, and fall on tip of shoulder. Weightlifting can cause traction injury. Overuse in throwers and swimmers can cause slap lesion in athletes. If we look at the rest of the population, in the same way, fall on outstretched hand and fall on tip of shoulder. Traction injury from losing hold of heavy objects, concurrent with shoulder dislocation, repetitive overhead activity. All these factors can cause injury. Risk factor: aging, overhead sports like swimming and weightlifting, poor scapular control, and posterior capsular tightness. All these are the risk factor that can cause slap lesion. Now we will look at the assessment criteria. First, we will do the physical examination. When the patient come to your clinic, first we will observe its posture. Is its posture is normal or not? Then we can perform palpation. Bicep tendon is mostly painful in this condition. Then we will move on the range of motion, external rotation, abduction may be painful, and strengthening is usually normal in this condition. To confirm our diagnosis, we can perform special test. Our first test is the O'Brien test. Here you can see therapist performing O'Brien test. The patient horizontally adducts and flexes the test shoulder against examiner manual resistance. Here you can see patient tested shoulder is in flexion and adduction, and therapist is applying manual resistance. The test is performed in internal rotation, then repeated the subject arm in externally rotated position. First, therapist apply manual resistance in external rotation, then he can apply in internal rotation. Pain or popping in internally rotated position is a positive sign that slap lesion is present. Second test we can perform to confirm our diagnosis is the anterior slide test. Here you can see examiner stabilize affected shoulder, scapula and clavicle with one hand. Here you can see the examiner is stabilizing scapula and clavicle with one hand and the other hand to push anterior and superior at the elbow. Other hand will be on the elbow and anterior and superior force will be applied. This forces the shoulder upward and will produce symptoms if a labral tear exists. Positive test suggests that slap lesion is present. Now we will look at the management. Management is divided into three phases: acute phase, recovery phase, and functional phase. In acute phase, we have to minimize load on injured tissues, correcting the timing of muscular activation. In electrotherapy, we can use heat cold tense that will decrease the pain. In the same way, we can use ultrasound as well. Gentle, active, and active assistive range of motion for elbow and wrist can be used. Pain free, gentle, passive range of motion for shoulder flexion, abduction, internal and external rotation can be used. In short, we can say that electrotherapy and gentle passive range of motions are mostly used in acute phase to minimize the pain. In recovery phase, our main focus must be on strengthening and restoring core kinetic chain and progressive isotonic exercises. isotonic strengthening exercises to increase shoulder strength should focus on muscles like rotator cuff muscles. Exercise to improve proprioception around the shoulder may also be included in this treatment. Here you can see some examples of strengthening exercises. In functional phase, we can use sport specific actions, includes endurance and ballistic exercises. Plyometric exercises may also be included in rehabilitation program, especially if you're planning on returning to high level sports and recreation. Thank you so much. I hope so your concepts are now clear. Don't forget to like, subscribe and share this video with your friends. Thank you so much.